So if you would get even to everyone again, go ahead and place your name and campus in the chat. Check your screen name, make sure that it shows, correctly, that it matches how it appears on the roster. Give me a minute or so to do that. Get my timer here. All righty, again, good evening to everyone. Make sure you place your name and campus on in the chat and also check your screen name. So let's go ahead and look and see where we're at and where we are going here. Go to the classroom. Welcome to week 5. It's like, wow, we just were doing orientation and now we're almost really halfway because that 12th week, as I said last week, that's for, just tying up loose ends and everything. And so you really officially finished that 11th week. So we are almost halfway. Let me share my screen here. So don't forget with your quizzes, you have that one time to sit to take that quiz. So make sure that it's a time frame that is, good for you so you can do your best on it because every point matters. The lessons, you can go in and do those. But the quizzes, you only have that one time to sit and take that quiz. And they're all are 50 questions. So just take that in consideration when you're actually logging in to do that part. So here we are, week 5. We're still talking about those on the healthcare team. We're talking about collaborating, in leadership and management. Then we're going to add that delegation piece to it. And then we said all of it goes back to communication. So we have that lesson and then quiz 3. We have our unit exam 2 for next week. So our content for unit exam 2 will come directly from week 4, because remember, we didn't have any new content for week 3. So you're looking at communication, those that are on the healthcare team, and that leadership. And we're going to begin to talk about delegation too. So those are going to be your main concepts. But although that's just 3 concepts, there's so many moving parts to that. So just make sure that we're gaining the understanding of what that is. And then we will take our unit exam on next week too. So remember, be thinking about what your schedule looks like, all of your schedules. In the event that you want that exam proctor, this is just a reminder that you have to find that proctor. The campus dean must approve that proctor, and you want to send that email that includes your campus dean, the proctor, myself, and Dean Brown in that communication. And so, although this is not a late time, sometimes proctors this time might not be good for them. I don't know. You just, whatever you want the communication is and whatever agreement you all come up with, make sure that all of that is included in the email. We do know that some campuses have all these things going on. So you want to make sure that, contact the proctor in time because they do want to, have a place for you, even though all the other time the conference room might be empty, but on that day and time, it might be, have been scheduled and maybe being used by someone. So go ahead and be thinking about what you need to do. And if you don't need a proctor, just scratch all of that. For those of you that were thinking about accommodations, if that's something that you need, I'm not sure what that process is, that application process, but go ahead and start that conversation so you can get that information in to your campus deans as well. All right, so that's where we are. And then we know your group projects, even though we're in week 5, they are due in week 10. So just be thinking about all the things that everyone has to do. And it's okay to go ahead and finish that project in week 8 if you can. And therefore, you just waiting on week 10 to turn it in and get ready to do your presentation. So, and that be one thing that you can get off your list. So it's okay if you have to revise things. You have to, go back and undo what you planned or or redelegate and assign tasks. That's all part of working in a group. And then, but hopefully you all can come up with a game plan and the steps to that common goal, which is to turn in that best product during week 10 and do that presentation. So refer back to that rubric so you can make sure while there's not a slide count, there's a time count, so your presentation must, be is time. So just make sure you have enough information so if you can talk us through because you want all your points. Just point out that. All right, so let's go ahead and look at week 5 here. Get it back pulled up. So again, I haven't said it tonight, but all these sessions are recorded and they are viewed by the attendance administrators. Just make sure that in the event that you are not on camera, that you send a message in the chat to myself. Go ahead and send it out to me so that we'll have it documented as why you're not on camera. Okay. So let me just share. This is in your announcement section. It is that blueprint, which says what we just talked about, the different parts of communication, leadership. What is leadership? Even though we're saying leadership, there are several pieces and moving parts that indicate whether or not this person is an effective leader or not. There are several things that they have to be thinking about at all times and making sure that everything aligns to be that leader. And then collaboration. And think about those examples that I gave. That patient that's needing physical therapy and also they're needing to go meet, they have a specialty appointment. How do we collaborate with the interdisciplinary team members, that referring doctor, the physical therapist, to make sure that this client gets all of the care and everything that they need. And of course, you have math on all of your exams. So we will place some more math problems and questions in the announcement section as the weeks goes on. We just kind of put those in there for you. All right, so let's go over our last content here for the week, and then we'll recap after we finish our content. We'll go back and talk about that. So this week we're talking about delegation. So in the chat, we're going to, we utilize our chat and it shows that we're, participating. So send a message out to everyone. If you are going to explain, give a definition, paraphrase what delegation is. We know it has several moving parts, which we'll look at them here in a minute. But just give someone a one-liner or a two-liner. You are explaining to a layman's person too. Put it in layman's terms what delegation is. So if a family member was to come up and say, hey, whatever, and you're trying to explain to them what delegation is, that task was delegated, what would you say to them? Let me give you 2.5 minutes. Delegation. I'm a little timer here. Okay. Delegation. So send it out so everyone can see it. 1 minute, 44 seconds. The task is in the chat. We are explaining, a family member has come up to you, the nurse, and the answer is defining delegation. What would you say to that family member? Remember, more than likely, they're not going to be a healthcare professional. So in layman's terms, just give us a definition in the chat. 1 minute, 20 seconds. All right, let's look at some of what you all have said. Turning the task over to another trained professional that's properly trained for the position, because we do know we all different have different skill sets. So even though that person's on shift, we want to make sure that that's a task that they can complete. Because remember, we have our lawful to-do list. That comes from the Nurse State Practice Act. And there, unfortunately, there's sometimes team members will ask you to do things that you're not supposed to do. That's not on your lawful to-do list, which comes from the Nurse State Practice Act. So that's a good point. Making sure, ensuring that the task that you're delegating, that that person is properly trained, that is on their to-do list to do. Because otherwise, that would be unauthorized use, and it can lead to negligence, abuse and things like that. So you are authorizing a person to act on behalf of you. Yeah, delegation is giving a task to someone who is able to perform the task. It means, and so as I'm looking at these, you all look at the different definitions too, because the more we look at things, you might not have thought about it in that way. And also it will help you remember it. So then the next thing, give tasks to someone who is qualified and has the proper training, passing off responsibility to someone else that is suitable for the task. Okay, so all good points. Do Even though the nurse delegated the task, is the nurse really ever, well, let me go back and see how you all had it worded. Is that responsibility really off the nurse's responsibility list? Does that, just because I delegated it to nurse or unlicensed personnel, whomever, does that task really no longer my concern or my responsibility? I see he is going from left to right. That is correct. No, even though I'm delegating it, I am still responsible for ensuring that that task is completed. In the event that the task included the person reporting back to me, like for example, we delegated checking blood pressure in the patient in room 201, and using, at 10 o'clock, and we just say every 30 minutes. So it's still my responsibility to ensure that that person, whomever I delegated to, actually did those blood pressures. And how can I make sure they to actually check those results? Hey, what you get? What you get at 10, what you get at 10:30, or whatever that communication line is. If they're supposed to document it on a form, go to that form and make sure that it's there. But that's correct. We are never, even though we're delegating it, it's that responsibility still falls on. It does not come off of our to-do list. We still have to ensure that it is properly done. Okay, let me just do some, let's see here. Okay, so before we get into it, I think we're going to get into it on this slide here, but just thinking ahead. What are the rights of delegation? So there's some, while when we are delegating, we can delegate. What are those things that we should keep in mind while we are delegating? We need to ensure, I think you all said the right person. I think we clearly identified that in the chat. So we have four more things. What are those when we're delegating? What are the rights? Like we have medication administration rights. What are those rights of delegation? So we said I think we got the correct person. So we're making sure that this is on their to-do list so they can actually complete this task. Okay, we have communication. We have supervision. Okay, so the communication piece is those directions. What are those instructions? What are the directions? Making sure that whatever we're communicating, we talked on last week, that sender and receiver, sometimes there's something that happens and the information that we communicated, the instructions or the directions that we gave, the receiver didn't interpret them the way that we sent. So we want to ensure that whatever task that it is, that right task to that right person, that information is actually interpreted correctly. Because in the event that they think that we need blood pressures just at 10 a.m. rather than at 10 a.m. and 10:30, then that person that we delegated that task to will only complete that blood pressure that one time. When in fact, we needed it every 4 hours or every 2 hours or whatever the instructions were. So good. So we have the right task. We want to make sure that the person that it is on their to-do list, it is something that they are capable and they can actually complete in that facility. Because we do know that that happens too. Certain facilities allow people to do certain things, and some facilities is not on their to-do list. So we want to make sure that it's correct task, the correct person, that we are communicating those instructions or those directions. And looking at chat, we need two more things. Two more things. Let's see what else you all are saying. Supervision. So if you are struggling naming these things, you need to know this because it's where we're going. From what I hear, Hesse is big on delegation. You have to know these five things in order to pick it from the situation. So make sure that you're jotting them down. I only see one response in the chat. So making sure that you know what these five things are. Okay, so we have the right person. One thing I don't see in the chat. So what's missing? In the chat, we have communication. So yeah, Sarah, you said right time, and then Wrinkle, you said circumstances. I think that's what you're I think that's what you're referring to, but it is the right circumstances. So what is another way of saying the right circumstances? See someone typing. So that is right. The right stable versus unstable. Ensure that you know that you understand that these are the rights of delegation. Just like we have rights of medication administration, you need to be able to, when you're getting ready to give this responsibility, making sure that it's correct person, the right task, the right circumstances. If this client, even if it's a blood pressure, even if it's a bed bath, and the circumstance is unstable, would we delegate that task to that person? Even if it's a task that they normally can't complete, and someone said no, that is correct. The circumstance, if it's unstable, even if it's a task we know that they can complete, we're not going to delegate it. Okay, so just make sure that you have those. So we got that part. All right. So let me just, so who can we delegate this task? Can we delegate administering, and we're talking about to an unlicensed personnel. Can we delegate administering Tylenol to an unlicensed personnel? Okay. Can we delegate measuring? Okay, the circumstances are stable. So we're gonna say the circumstances stable. Can we delegate wound care? Okay, I think I'm seeing, okay, I think people are saying no. Can we delegate putting on heel protectors, sequential SCDs, those things that we put on the legs to keep the blood flowing, heel protectors, SCDs, with some other things that we apply. I don't know what they call them, but they're like those little beanie babies. And they're repositioning, they put them around people, but inside of them, the pillows, so we can delegate that task. What about blood pressure or glucose? Finger stick. Okay. What about interpreting whether or not that glucose or that blood pressure is high or low? So not only we are asking them to get that measurement, but them actually determining whether or not that value that they got on the machine was it high or low, or if they check the manual blood pressure. No, we cannot delegate them to interpret. I saw a hand and it went away. Whose hand
I
was
have
it?
put I have put it down because at first I was like, well, blood sugars can be delegated because it depends on where you're at though. Hospital, yes. Nursing homes, no.
So I asked you two questions. Can they measure the glucose? Can they measure the blood pressure? Then the other question was, can they interpret those numbers? Can they tell
Mm-mm.
you,
No, they can't.
determine whether or not they're high or low? In their minds,
No.
they probably can, but realistically, we can't. Now they were at home and we went in to teach them, they were at home taking care of their loved one. And that's where, people are like, well, they were at home. That's a different setting. So yeah, we can teach them there. But in those settings, they can get those measurements for us. And they may outright know that this blood pressure is high or low or glucose is high or low, but we cannot depend on them to interpret those results for us. So that's correct. Okay, let's see. What's some more examples? What about setting up uh, a sterile field for the doctors getting ready to do a procedure? Can they set those sterile fields up? Okay, I'm seeing no. What about obtaining consent? Go on in there and get that patient to sign this paper for me. I already went over it with them. Can you just go back in and get them to sign? I see he is going from left to right. That's correct. No. What about putting in orders? I don't think I've seen that in any set now. Although the unit secretary puts in orders, but not the unlicensed personnel, the patient care tech. We don't see them put in orders. Okay. All right. So again, and you can say this to yourself silently, I'll give you 30 seconds. What are those five things that we're going to look at? The five rights of delegation. So in your say them to yourself silently. So make sure you have that. We just gave you some examples, some scenarios. Um, what about turning and repositioning a client? Can they do that? Client stable. Okay, good, good, good. What about updating a care plan? Okay. What about reading the care plan to see what it says for them to do for the care for them to provide to that patient? Can they read the care plans? Yes. And most facilities, those care plans are available so they can see, where it says two persons assistance for, turn and reposition or whatever it is, all those tasks. So they can look at those care plans. But as far as updating and formulating diagnosis, no, they're not going to be doing that part. Okay. So I think we got that part down. So generally, those tasks that you completed and you had to get checked off on, and then that you're doing in clinical, besides the, making the beds, providing the baths, checking the blood pressures, those other tasks, those skills, doing wound care, um, installing those Foley catheters, dressing changes, and things like that. Those tasks will not and should not be delegated. Even reinforcing teaching, we wouldn't ask them to do anything with teaching or determining um, any information. All right, so let's move on here. Okay, my little PowerPoint right here. Okay, let me share my screen. So not only we're talking about delegation, I gave you some examples of how to apply it. So I just want to make it's rare that you all don't know the content. It's like when you go to apply it, to think it through. And then, like she just mentioned, like some settings allow you to do things, but that second question was interpreting. So make sure that you're reading the question. Got it. All right. Move this little thing out right here. Okay, so there's differences between management and leadership. So we have the leader and then the manager. And sometimes, you pivot. Sometimes you're focused on task as that leader, you're focused on completing that task. And especially if it's emergent. But if we had to sift them out and put them in categories, the leader is people oriented, and the manager is more focused on that task. Not they consider the people, but not as much. It's like, okay, let's get this task done. You're clocked in. They hired you, so it means that you must be able to. You're here to. You can complete what's needed. You're here to take care of the people. So let's get these tasks done. So that's more of that manager. That leader does consider, the people. Hey, hopefully everybody's doing good today. They provide that motivation. They kind of toggle back. They made their conversations kind of surround what the vision is for that facility, and then all the moving parts of the strategy to meet that vision and the mission that is why they're existing. And the leader, they listen and empower. And it doesn't mean because you're listening to people that you're going to change the rules, but it does mean that it makes it more human. And also sometimes it provokes thoughts that you really haven't thought about because we know policies and procedures can be revised. And so it goes back to that. I kind of think of that leader is that having that spirit of inquiry, not that they're challenging the current practices, but just thinking outside the box. Hey, can we do this, complete this task with better outcomes, using less people, less resources? Will this client have better outcomes? And so, if we had to separate the two, this is how they would define the manager versus the leader. Neither is bad, so you need all of those in your toolbox, just depending on the situation. So the differences between management and leadership: management coordinate people, time, supplies to achieve a desired outcome in a defined area of responsibility. They have an appointed management position and a formal line of authority and accountability. That leadership, that leader ability to empower and influence the beliefs, opinions, or behaviors of a person or a group by guiding, motivating, and inspiring. So it's just really just rewording what we just said. May not have a formal authority, but are still able to influence others. So just think about, and because you're getting ready to be that team leader. So just think about, you are leading the team, and you have to coordinate people and time and resources to take care of whomever's care that you're in charge of. Now, this is three leadership styles that they've identified that at some point in time we may have all used. The autocratic specifically focus on that task. And then, so autocratic kind of lines up with the manager type style. They're focused on that task. Democratic is a balance, and they take in consideration, they give more thoughts. Not that we're changing, not that we're not going to take care of that patient and provide what they need. Is it just we're considering the task and the person that will actually, the employee, the person that will actually perform those tasks. And then laissez-faire, concern with the employee. It's getting ready to be Nurses Day. It's getting ready to be CNA Day. It's getting ready to be to start celebrate all of the different people on the healthcare team, and you can kind of see where, as they plan activities and things in those facilities, things are kind of lax. But nevertheless, they may have all these activities, breakfasts. They even may have where people are playing some type of team, doing some type of team building. They're still going to provide the best care for their clients, but they may allow the employees to decide what activities do they want at that facility for them to enjoy during that week or on that day. Okay, so this is just sifts it out a little bit more. So autocratic does not share responsibility and authority with employees. It's this. Let's get it done, and this is it. Emphasis is on the policies. And that autocratic tells employees what tasks to do, does not seek input from the employee at all. And the autocratic may reach the goals. And like I said, it's times that you will need to use this, and especially during crisis situations, we need to know what those whatever that policy and procedure is to use in the event that there's inclement weather, in the event that there's a fire, in the event that there is an active shooter. Those responsibilities and tasks need to be given out, specifically, in cold situation. That's a crisis situation. But laissez-faire gives away responsibility and authority to the employees, put employees before policies. Now, this would not be good in the event that something that comes to mind and a breaks. Most facilities have these standard break times. Most of them do, some of them don't. And then if they do have these standard break times, they make the staff break times are centered around whatever else has to go on in those facilities, like the long-term care facilities. They're pretty much standard on breakfast, lunch, and dinner. They're pretty much standard on the times that they have activities. They're pretty much standard on if they have to bring in the foot doctor, the eye doctor to come in to see the clients. They pretty much have these set times. So they kind of center the time that's left over. That's the time that they kind of lead or have put in place so the employees can take their breaks. And so in the event that the staff does not follow those times and we're following this laissez-faire, that means that some care is not going to be rendered. Some care is going to be lacking. So you have to be careful with that laissez-faire, because if you're trying to please everyone, we're there to provide that care for those clients. So that's not the setting to pretty much, unless it's like I say, an activity where they're trying to decide what's the activity we're going to do this year for Nurses Day, or what's this activity we're going to do for whatever, some type of celebration. But when it comes to care, there's not that much leeway with that. So democratic, it shares a responsibility and authority with the employees, enforces policies, but with concern for the employees. So it enforces the policies, but it does take into consideration the input that the employees have actually shared. And then it seeks input from employees and encourages problem solving. As I mentioned last week, they have the ethics committee, they have the PR committee, the public relation committee. They have all these different committees. And so that those committees you might not want to work on, but you might. So once you do your onboarding, ask, hey, what other committees and things does this facility have? Because you might want to be the PR person, the face of that facility. So you're the person they'll send out to do when they have health fairs and job fairs and things like that. You'll be on that team that go out and tell about that facility. Because of involvement of employees, goals may be achieved with positive staff feelings, daily nursing care situations, meetings and committees, review of care plans. That's all part of what we have to do. A lot of facilities, especially long-term care facilities, they have, we as the LPN can work as a care plan on the care plan team. And that's what you do all day long. You take into consideration of what that client needs and help formulate and work with the RN and that team to come up with those care plans. Okay, so situational leadership. Here's another one. It involves, and we already know the word situations in here, situation. So that's going to mean that it varies. Involves varying your leadership style to meet the demands of the situation. Depends on what the situation is, depends on what style of leadership that I use. According to this system, the LPN needs to use a leadership style that fits the work situation at hand. Like we say, is this a crisis? Or is this routine? Or is this where we're planning for a team building exercise? So we take in consideration the situation. So those core knowledge and skills, of course, we problem solving. As you're working on your week 10 project, some things you have to communicate. There are different forms of communication. Verbal, I mean, you can, communicate all those different text messaging, all those different platforms. You have to problem solve. What is our plan? Who's going to do what? In the event that something, an emergency comes up, let's revise the plan. Let's do some team building. Okay, you can't do this, but okay, can you, like, let's change up tasks. And it is stressful to work on a team. So that's just part of how we're going to manage the stress by communicating, identifying what the issue or the problem is. A lot of it is we haven't identified what the issue or the problem really is. We're talking about things that's irrelevant to what the issue, the problem that really needs to be solved. Okay. So motivation, drive that causes individuals to set those personal goals and reach those goals. We have those things that are inside and those things that are outside. Those both of those are motivating factors. And so just know that those things are there. The facility, they're wanting to have, good ratings and things like that. But inside we want to feel that we're growing within a organization. We want to feel that we have that achievement and being recognized. And that's why a lot of facilities they do take the time out to recognize their staff. Sometimes they'll have the person of the month or something like that. We know hospitals have the Daisy Awards. I think those are everywhere. But besides that, facilities are taking, those smaller times to recognize people. And that does make you, it increase your job satisfaction and it contributes to your personal growth because you said, oh, I can go on another day. I can go on another day. So job satisfaction attributes, value, growth, real connection, and empowerment. So you're going to be leading those teams. They're going to be coming to you and asking questions. Let's stop right here. Let's do something interactive here. Let me see. Ask you some more questions. Let's see. Let's see. Let's do some what ifs. Let's see. So, wouldn't you all tell me that talk about the people on the healthcare team, the speech therapists, what do they do? All things what? Speech therapists. Let's see. I must be putting it in the chat. Nope, don't say anything in chat. Someone come off me and tell me what the speech therapist. What do they do? What part do they play in?
They usually are. Um, I just had a brain fart. Oh my God.
Someone else help jump in and help her out. Speech therapist. What do they think about?
Help with communication.
Swallowing, communication, aspiration,
Mhm.
precautions,
Okay, that is correct. So, what disease process do we normally? Something has happened to this person. What has happened? More than
stroke.
likely, happened. Stroke. Usually, we pretty much going to see that speech therapist for someone that's had a stroke, because we know that not all strokes, but a good amount of them affect a person's speech and their ability to swallow. So we'll see that many times. So, what about the radiologist?
Imaging,
So what part of the imaging? So think about we have an X-ray technician and then we have a radiologist. Who does what?
X-ray technician is the one that actually performs the task. Radiology is the one that reads it.
Okay. Okay. All right. Let me see who else we talked about. What about that pharmacist?
And pharmacist is the person that actually receives the medication, and the pharmacy tech is the one that prepares it.
Okay. So they also dispense it. And then remember the pharmacist, if the medications have to be, remember I told you all about the medicines now. I've seen it a lot with the blood pressure medicines where they're putting several medications together and they call it compounding. And so they're the ones that actually do that. They call it compounding. Let's see. We kind of said the case manager and the social worker kind of do the same thing. What do they do? Tell me about the case manager and the social worker.
I can't remember which one is which, but like you said, they usually are pretty much neck and neck, but it's mainly home plans, um, placements if they need it, um, basically care after discharge.
Okay. They focus on that care for discharge. We know that discharge planning begins on admission, even though we know that it might change before, but we need to start thinking about one because this person's coming to the hospital and they're gonna stay there, forever. They're gonna be discharged to long-term care facility or home. That's gonna be, and we want them at their optimal level. And when they leave, we want them to be able to manage their care. Um, so they look at everything's discharge planning. Well, we said the social worker, most of the times, they have some more resources that they can identify. We mentioned like Meals on Wheels, the pharmacists, some of them deliver. But there's some other resources out there that the case manager might not know about, but both of them focus on that discharge planning and that person being able to manage themselves in the home. Okay. Let's see who else is on there. What does a dietitian do?
Dietitian basically well, the doctor makes the orders for the diet orders, and they just pretty much carry it out.
Okay. What else? So they oversee those diet orders, but do they make any other recommendations or anything regarding the diets?
They can.
Which condition would a client be experiencing? And we would need to bring, and there are several out there. We need to make sure that we get the input from the dietitian.
Diabetes,
Um,
Okay, diabetes. What else?
Crohn's disease,
Okay, Crohn's disease. Why is it with Crohn's disease and diabetes? What is it? We're trying to make sure what?
stabilize our glucose levels,
Okay. So we want to make sure that we're looking at all those food choices and ensuring because we want the person to, and with the what'd you say, IBS, irritable bowel syndrome, we want to make sure this person at least has enough calories. Think about with wound healing, someone that has a wound. That person might need a few more extra calories because now they're dealing with this wound as well. If the disease process is not allowing the body to process the foods that they're eating, that dietitian can give us that input on some either identify some high protein or high calorie foods that are not, high in cholesterol and things like that. So all things nutrition. So they're going to ensure that that diet, and even let's go to that stroke patient. That person has a problem with swallowing, and that speech pathologist or speech therapist has recommended for that patient to have thickened liquids. I don't know if you all have seen them, but liquids can be like how we just drink water. That's considered thin. But you know what honey is? You know what nectar is? People's liquids can be thickened to those consistencies. So we can drink an orange juice or a soda or whatever, but there is a substance they can place in those liquids and make them those different consistencies. And if the speech pathologists have determined that this client is not safe in drinking thin liquids, and they recommend that this person have nectar consistency or honey consistency, then that dietitian is going to ensure that their staff has those instructions and also prepares those liquids. And even if not only the liquids, but think about the food. Someone requires pureed food. If they require mechanical saw, if they require a certain calorie count, someone mentioned a diabetic. Sometimes you'll see diabetics when they're in facilities on 1800, different count of calories. So that person, that dietitian, that's one person that we would make sure that we're actually including in that conversation. So we said that the surgeon, of course, will do the surgery, but they can also, they're the ones that's prescribing that pain medication also. In addition to the speech therapist, we have the physical therapist, mobility, trying to get that patient back up and moving, moving, getting back to that close to that norm as possible. So each member on the healthcare team is important. It is also important that we have good communication skills. So, because we're thinking about the dietitian is not going to know that this client has a wound unless we communicate that to them. The dietitian, they may know that this client might be losing weight because I think that they also look at the weights and everything, but they might not know that this client actually has a wound. I think they're supposed to look at, all of their diagnosis. So they might know that they're diabetic. They might know that they have Crohn's disease. They might know that they have hypertension. But things like wound care, we more than likely will have, even if the client has been there and they have pneumonia, or, we might need to bring that to their attention. So, because they might not, I don't think they do a deep dive in the chart like that. But we do need their input because that client might, unless it's contraindicated, they might need more calories. The other thing that I think about on the other side, what if this client is on fluid restrictions? Who oversees that? In addition to the nurses there, the nurse is going to be there, but the dietitian, when those meal trays come out of the kitchen, if that person's on 1,000 cc cc food restriction, they have to decide. And also not only with their meals, but their medications as well. They have to consider the 3 meals. They may or may not get snacks. So they do the 3 meals, but then they also have to consider the medication, the med passes, because you got to stay within that time frame, that amount in that time frame per 24 hours. So that dietitian can help you and assist in dividing up how much this person gets with each meal and all of that. Have anyone encountered someone on fluid restrictions and you seen, okay, you all have seen it. Okay. So yeah, everyone is important, but it's going to take that communication. We might know that they're on fluid restriction. We want to make sure that that dietitian use there some type of communication to either electronic. I even seen, even though the order is there and it's under dietary in the computer, still there's an additional step where that nurse, that leader, that charge nurse will have a written communication and they'll actually go sit with that dietitian or make sure they have that one-on-one where they're collaborating, they're talking about this individual client's needs. And so that they can come up in that example with how much each nurse needs to actually administer to that client doing those med passes. Because if someone's on fluid restrictions, you want to make sure that they stay within those restrictions because we want to add to that extra fluid because otherwise it's going to send them into an exacerbation. The client's going to do it worse because they have too many fluids on board. So effective collaboration involves sharing observations and inviting input from other disciplines And the whole point is for us to provide that best care, that to optimize that client's outcomes so they can have positive outcomes. So that collaboration is going to be necessary. Okay. All right. So let's go back to our PowerPoint here. Let's see. Share my screen again. Okay, so you all did list some other examples when we were asking about the speech therapist. Good. Hitting anything, that person, if it's going to block, think about what about if what if the dentist just came? Does does the dietitian need to be pulled in or informed of anything? Usually the dentist will say soft foods or something like that, or no straws. So yeah, so anything that's going to deal with that GI, and we know the GI system, it begins with breaking down that food, those teeth, that mouth, that tongue. And so anything that takes place with breaking down that food. Okay. Okay, so hopefully everyone will be satisfied on their job, but we do know that sometimes conditions are just not so. Availability of equipment. If the job, we're supposed to be checking blood pressures, we don't even have the equipment there. We need the clients on an IV and we don't even have IV pole. Some facilities don't have those pumps. They may still have the dialer flows. Y'all know what a dialer flow is. So it does not require electricity to run. It's someone designed it, and but not having those things there is going to make a difference in whether or not you're satisfied in that job. And you're not going to want to stay in the event that you don't have the things that you need to do to take care of your client. Unrealistic workload. Some states do have the nurse patient ratio. In some states, it words it as the facility deemed safe. So what's that number? You know? And so, but nevertheless, remember, you're going to be working under your life. So have those conversations um, with whomever you need to have conversations with so that you can just make sure that you're understanding and you know all that you need to know so that you can make an informed decision as well. Is this the place I want to be working in? Okay. So communication skills. We talked about this last week. Active listening, writing. We're going to be talking on the telephone. There may even be electronic messages, nonverbal and verbal communication. So team building, stress management, stress due to dysfunctional. Let me check my time here. Stress due to dysfunctional job behaviors, create less stressful work environments, lifestyles to help control stress. If you're having to work, sometimes we have to say, can't go to the family, whatever, or I may have to go to the family event and leave early because then, once you get to work, it's going to be realistically, if you're in the hospital, you may have 4 or 5 patients. If you're in that long-term care facility, you may have 18 or 20 patients. So they're going to need, your best. So identifying signs of stress. We were going back and saying this slide right here, if you going to work and you don't have the equipment that you need, say something. Say something. Okay. A, B, C, D, ways of increasing awareness of irrational thinking, activating belief, self-talk about the situation, and then consequences, and then dispute irrational thoughts. Is this rational? Am I thinking rational? Because sometimes our thought process can get irrational. So think about it. Am I thinking this through correctly? Refocus. Think about the things that are things that are factual, that are real, and so that we're not being irrational. Okay. All right. So how to create that less stressful work environment? Let's see what they tell us. Create that calm environment. Encourage nursing assistants to take breaks as scheduled. And then, once we get into that routine, the example that I gave earlier, where it's feeding time, it's meal time, and staff is on break. Well, that wasn't a break time. Well, who's going to feed? Who's going to help assist with the people that need assistance? So we want to stay to whatever those policies and procedures are. Having visitors are coming in. If it's the rule that they sign or scan in, make sure that we're following those policies and procedures because it's going to lessen that stress. If something happens. Well, let's go back to the law. Well, let's see, were you on break, or where was the staff at that was supposed to be taking care of this client? Okay, they were in another patient's room providing care. Oh no, they were on break. Oh, okay. So let's stick to what the policies and procedures are, because that just lessens stress. So we have this problem solving steps. Collect the data, get all the information. Sometimes it's word of mouth, sometimes it's written, sometimes they maybe even rolling the camera back. Most facilities have cameras, and they usually tell you they have something displayed that's saying that you're on camera. But nevertheless, collect the data. The next thing is define that goal, that problem. Define the problem. What is the issue? And then set the goal, select the interventions, and then evaluate to see if what we're doing, is it really working? Is this working or not? Okay. So specific knowledge and skills needed: occupational clinical skills, the knowledge and skills of nursing, documentation. We want to think about the legal aspects, the federal regulations. Remember, it's not on our lawful to-do list. It's not in our Nurse State Practice Act to say that I can do this in this facility. We want to stay away from it, because then we have these legal things. And people can sue the facility as well as the nurse as well, and everybody is taking care of their loved one. Organizational skills, time management, you all. I tell you that procrastination is not your friend. Take it from me. Procrastination is not your friend. Time management, continuously quality improvement. How can I improve upon me? What do I need to work upon? Work on. Do I need to check some more blood pressures? Because my hearing, making sure I'm hearing correct, my technique. As you become a nurse, to continue to keep those licenses, states usually require continuous education. So when you think about that quality improvement for yourself, because facilities have these qualities improvement for the facilities as well, but we're talking about self. Those continuing education classes and requirements that you can get, try to think about what you want to improve upon or learn more about. And let that your continuous education be centered around that. If you want to learn more about wounds, you want to learn more about hypertension and how people manage it. So let your education be around or specifically about that. So, human relationship skills, the ability to get along with and relate to people. How are we doing with that? We're getting I don't know if you all have done group projects, but you're working in a group. You have a group project that's due week 10. So, how are we doing with getting along? We know we're not all going to agree, but do we want to be aggressive or assertive when we're in groups and when we're putting groups and talking, or we're talking about everything but what we're supposed to be talking about? Just making sure that we refocus ourselves. How are we with anger management? You all will, as the nurse leader, you'll be completing performance evaluations on others. So, just making sure that we understand what that's all about. We want to also empower team members and encourage that personal growth. If someone identifies, something that, you know, they think that we'll be really good at, the ethics committee, the public relation committee, that's part of your personal growth. So don't shy away from that. Now, if you go to that committee and you see it's not working out, okay, hey, acknowledge, hey, this is not working out. But it might be the next thing that pushes along your growth chart. Increase self-confidence in team members, and then having that non-judgmental attitude. Just because we disagree that means that I'm a bad person, or the team member's a bad person, or anything. We just don't agree. Okay. So assignment versus delegation. So again, we're gonna give you a minute. You don't have to respond in the chat, but what are those 5 tabs of delegation, the 5 rights? So I'll give you a minute to do that, because we're getting ready to dive a little bit deeper. So, but you have to know that in order to move further. Trying to get my little clock pulled up here. Okay. So what are those 5 rights of delegation? 5 rights of delegation. So can we ask the UAP, the unlicensed personnel? We gave Tylenol. The patient had a fever. Can we delegate the unlicensed personnel to assess and evaluate whether or not that person still has a fever? Or can we delegate the unlicensed personnel to go check the person's temperature? Which one of those can we do?
They can check the temperature and you can decide as the nurse if they still have a low grade fever or a high fever.
Got it. So see how that it almost sounded the same, but one of them, the first example required that UAP um, to think it through, to make some decisions, to evaluate, to compare, and things like that. So we're not asking the UAP to interpret, but we can definitely ask them to get that temperature. Okay. Well, even if it was pain medication, would we ask the unlicensed person have to go and ask the person to rate their pain again? Okay, our little time is up. If we gave medication for an antihypertensive, can we ask that UAP to get the blood pressure, or can we ask the UAP to get the blood pressure and determine whether or not that medication is therapeutic? Which one of those can we ask UAP to do?
We can ask them to get the blood pressure.
Okay, got it. But deciding whether or not that medication was therapeutic, if it's worse, if the blood
That's
pressure is
on the
good,
nurse.
that's on the nurse. Got it, got it. Okay. All right, so we're there. So hopefully you wrote down those 5 tasks. Someone come off mute and tell me what those 5 tasks of rights of delegation are. 5 rights of
Um,
delegation.
right risk, right communication, right person, right direction, and right supervision.
Okay.
And the
Someone,
right task and right circumstances.
Yeah, I knew I was missing one.
okay. So someone else give us those 5 rights. Come off mute and tell us.
Right person, right task, right circumstances, right supervision, and right communication.
Okay. And what do we mean by circumstance?
Is the patient stable or unstable?
Okay. What do we mean by directions? What's another word we can use for directions? Instructions. Steps 1, 2, 3, 4. So, all right. So let's look at this assignment and delegation. Delegation transfer responsibility for the performance of an activity from one individual to the other, while accountability for the outcome still remains in the person that delegated. So even though we're the nurse, we're delegating that blood pressure at 10 a.m. and 12 noon or every 4 hours, or um, uh, giving that person, assisting that person with their bath, doing day shift. Even though we're delegating that, the outcome is still retained by the delegator, the person, the nurse that actually delegated. So the delegatee, the person that we're delegating it to, they must agree to whatever it is that we're asking them to do, that delegation. And if they don't agree, we can ask, you have that conversation. As far as that leader is to find out more, like what's the issue? Is it something that you don't understand? What are the circumstances? What is it? What's the reason that you're refusing to? Is it not on your skill list? Have that conversation about why they are refusing. Okay, so delegation also includes management strategy used to ensure the accomplishment of cost-effective client care, which has been shown to increase client outcomes and satisfaction. Okay, so an assignment, that's distribution of work that each staff member is responsible for during a given work period. Activities are consistent with job position and description. So we're not delegating anything. We're just going to go down and do all what's required. The staff member assumes responsibility and is accountable for completing the task. Delegation, we are asking someone else, but we are not relieved of the outcome in making sure that that task has been completed. Okay. Where can I find information on delegation? The State Nurse Practice Act. We have said that It will provide guidance on legal delegation and its regulations. Not every state allows an LPN to delegate, so see what your state nurse practice act says. And for those of you that will secure the multi-state license, when you're in that state, you have to make sure that you are performing according to what that state allows you to perform. That multi-state license allows you to have that one license, but still within that state, you have to follow that state's nurse practice act. Delegation is not a required act. We as a nurse can complete whatever those tasks are. State Board of Nursing may offer guidance. The LPN should understand the legal scope of practice for a CNA and UAP. So we need to also understand not only our role, but their role. Because if we're going to be delegating, asking them to do things that we're responsible for, we need to see what legally can they do in this facility? What's their legal scope of practice? Because then that's just going to be even more trouble if we're asking them to do something that's not in their legal scope of practice. So other resources for positions on delegations. We want to look at that rules, that facilities, that organization's rules and policies. And usually is rare that the rules and policies of a facility does not line up with what the UAP scope of practice, the LPN scope of practice, RN scope of practice. Those things should line up. So that task or that job list, what do they call them? You go to the interview, they tell you what your job responsibilities are. Those things are going to line up with what that nurse practice act does, because that's where the facilities get them from. They pull that information. So they should not be asking you to do anything that's not in your scope of practice. So professional nursing organizations, they may have already visited your facility. The National League of Nursing, they have all different type of organizations out there, and they just provide specific information regarding, whatever their goal of interest is. So it's all things LPN, all things the nursing league is, it considers all of the nurses. So you just have a wealth of information and opportunities to learn more and to add to your skill set. So rules and regulations and interpretations and guidelines and memorandums regarding delegation on your state's Board of Nursing. So you'll get your own license number, you have your own login, and they'll send you communications. The Board of Nursing will periodically. All right. So we said, let's see how do we do. We said the right task, delegated tasks must conform with the established guidelines. And we said the right circumstance. Delegated tasks does not require independent nursing judgment. Right person decide who is qualified and competent. And then we said the right direction and communication. Is the information clear? Is this a clear explanation? The person that you're delegating it to, they understand what you're asking them to do, the steps about the task and outcomes. And when the delegatee should report back to the OPN. So not only are we asking them to measure the blood pressure or the vital signs at 10 a.m., but we need those also reported back to us. Clarify timelines and expectations with the delegatee. This should be done every 4 hours or some, because there's some people that might have turn and repositioning every hour. There have some that we're doing in output every hour, every 4 hours. So make sure that the timeline and expectations are spelled out. They're clear. And then right supervision and then evaluation. Feedback to assess and improve the process. Evaluate client outcomes. So I think we did pretty good. We had all those. Stop sharing here for a moment. And we're going to take our first break. What time is it? Let's see. So let's return. It says so 7:30. Oh, 7:37 your time. So let's return back at 7:43. 7:43. Okay. See you in 5. All right, let's come on back in, you all. Our times. I want to make sure we go through everything, which I think we will have enough time. Let's see here. So if you had to explain, let me hear your voices this time. If you were explaining to someone, giving someone an explanation as to why care coordination is important, what would you what would you say to them? Care coordination. We were trying to tell them why it's important. Let me hear from three of you all. Just come off mute, take your time. Care coordination. Like, what is it? Why is it important?
It keeps everybody in the loop, like doctors and other nurses and other care members. That's why you document what you're doing so things don't get done twice or missed.
Okay. Let me hear from two more. Take off. Take the mute off and let me hear your voice. Care coordination. Why is it important?
To ensure safety and maybe more effective care.
Okay.
All right,
One
care
more.
coordination is important because you want to make sure everyone's on the same page, making sure that the patient gets the best the healthcare ever, the best experience to ensure a successful recovery if they're in recovery or if they're transitioning, like if they're very ill, and they're on hospice. You want to make sure you do pain management, stuff like that, and you want to make sure that their diet is okay. So it's a mixture of things. That's why care coordination is important.
Got it. It's essential for improving that overall quality of care while reducing healthcare costs. It is fundamental in improving the quality of care that we give. It considers the patient needs, their preferences. It helps us to ensure that the more that services are not duplicated, that there's not underuse, that a client doesn't use a service that's out there. I know, for example, there's a service that most insurances cover for diabetics to have diabetic shoes, specialty shoes. And so it's something that a service that's underused is there as part of that resource that the insurance provides, but because it's not discussed or talked about, or they just don't know, that's an underusage. Um, and so that care coordination, it organizes care and information around the patients, the needs, and the purposes. But it is that essential piece in providing that quality of care, whether or not that client's transitioning, getting discharged, and then altogether reducing those healthcare costs. Because if someone knows, what this client preferences is and are what they need to have the care that they need to take care of them, then there's a lessened chance for underuse or misuse of resources. Okay. So we talked about Virginia Henderson. What was her focus on? We kind of narrowed it down to either I'll give you a clue. Either you're well or you're what? What's the opposite of being well?
Ill.
Ill. Exactly. We kind of narrowed it down. Her focus is assisting that person that is sick and well. So whatever those activities that's contributing to their recovery and or them being able to manage or stay well. But we kind of narrowed it down to, like I said, there are all these theories out there, but for some reason we just talk about Virginia this time. I think we bring in a few more on the next term, but on the next couple of weeks. But ill or well, and it's all those things that make up helping that person to manage their chronic disease process, helping that person to get back to their optimal level, or helping that person to prevent illness altogether. All right, so let's go back to our point. So we're going to do it at the end, but I'm just kind of sprinkling in, all of our concepts that we've done so far, and with these new ones, these new concepts that we are talking about this week. So we just talked about the 5 rights of delegation. Share my screen here. Okay. All right. So why is delegating important? It increases the effectiveness and the efficiency of that nurse. So it frees up that time that they have to do other things that cannot be delegated. Because you're like, oh my goodness, I have all these things to do. So that delegation frees up. It doesn't mean that that nurse, goes to the desk or go on an extended lunch break or anything like that. But it does lessens up time so that nurse can focus on those tasks that cannot be delegated. Okay. So delegation, before you delegate, the client must be assessed, data gather on their condition. And we were talking about the circumstances. Is client stable versus unstable? The CNA or the unlicensed personnel cannot delegate. So if that CNA or unlicensed personnel accept that task that has been delegated, they cannot transfer it to another person, and then they cannot delegate tasks. So delegatee can refuse delegation, which we kind of talked about that. Then we want to ask if they're refusing, what's the reason? Let's have a conversation about that, see what is really going on. For proper delegation, the function must be voluntarily accepted. And then we use the nursing process when assigning tasks and or delegating. Can't get away from that nursing process. It's just a good process to keep us streamlined and within the realm of doing things safe, rendering that safe care. So legal aspects of delegation, keep in mind, the delegate only if allowed by your state Nurses Practice Act and that facilities policies. Like, I think who was that? Was that Sarah that mentioned that? In the long-term care, she's seeing that they can't delegate, but in the hospital you can. So see what's in that Nurses State Practice Act, and then also that facilities policies. So don't think just because you did something at the long-term care facility that we can do it in the hospital, and vice versa. So determine stability of that client's condition. Delegate duties for which nursing assistants have demonstrated the ability. Usually they'll have a skills checkoff list and they'll be signed off on it. And you can see which tasks that they have demonstrated ability, that they are competent and can be delegated those tasks and can complete those. We do want to provide specific, objective, clear-cut directions to the nursing assistants for the delegated tasks. So ensure what we're communicating, those instructions, those directions, whichever words you want to use, that they are clear, they're specific. Measure the blood pressure every 4 hours. Which one is more specific? Measure the blood pressure every 4 hours, or measure the blood pressure every 4 hours at 8 a.m. and 10 a.m.
Yeah.
What's that?
The second one.
The second one, yes. So be as specific as you can, because that person, whomever, can come up with whatever they every 4 hours. All right, it could be, well, okay, they said get them every 4 hours. I'll get them now, then I'll get them, So be specific and clear with those instructions. And then once you get those, I need you to write them on whatever, or, place that information here or report them back to me, whatever the instructions are. You do want to provide assistance and instructions to the nurse assistant when you delegate a duty. Monitor the activities of that nursing assistant when they carry out those delegated duties. Depending on that nursing assistant and that situation, this monitoring can mean anything from being right there or periodic checking. So whatever you deem that is feasible for that situation that you're in. Intervene if correction is needed, because you do want to keep that patient safe, the worker safe, you safe. Intervene if correction is needed. On completion of the delegated duty, you want to evaluate the safety and effectiveness of duties delegated to the nursing assistants. Okay, if you delegated improperly and a resident was harmed, guess who it comes back to? The nurse that did the delegation. This could result in disciplinary action against the nurse's license and also a civil suit. If you delegated properly, include monitoring, and was the client injured, the nursing assistant is liable. So let me read that again. If you delegated properly, including monitoring, and the client was injured, the nursing assistant is also liable. Because remember, I just said that they can come back into the facility, the nurse, and whomever, the physical therapist, everybody that's involved in that patient's care. That includes the unlicensed personnel. Delegation should also occur in collaboration with an RN. According to the American Nurses Association, National Council of States Board of Nursing, the RN should follow the 5 rights of delegation, which we already said: they're the right task, under the right circumstances, the right person, the correct directions in communication, and under the correct supervision and evaluation. Okay. Some routine tasks that might be delegated to the nursing assistants. You want to review your 5 rights of the delegation first. And I gave you some what is. Let's see. Personal care. That includes hygiene, dressing, toileting, grooming, and skincare. These clients are stable. Feeding and hydration. Basic restorative skills, including transfer, positioning, ambulation, and maintaining range of motion. A lot of times they'll add that range of motion once they do their bath. They'll have them to do the range of motion exercises. Measuring and recording vital signs, height and weight, and intake and output. Nowhere on here does it says interpret or to determine if it's high or low or within range. Assistance with elimination, including catheter care. Maintaining safety factors, including fall prevention, application of heat and cold, and infection prevention. Collection of specimens such as urine and stool. And for all of these in the facilities I've been in, you have to get checked off on these things. So it's going to be on a skills list that person has been checked off or signed off on it. And it says that, hey, they're competent with these tasks right here. So we can delegate those tasks to them. Examples of duties not to delegate. What does your state nurse practice act allow? So keep that in mind. Things that we're going to not delegate. I asked you out earlier. Let's see, how do we do? Complex sterile technique procedures. Nursing assistants do not have an in-depth training in sterile technique. Crisis situations. You are going to be that person. An example of a crisis situation is a resident who develops chest pain. They're going to call out for you, the nurse. If inclement weather is coming, hey, what do we do? Who do we pull out? Fire. Usually the nurse is going to be one of those nurses is going to, depends on what section is in, that nurse is going to be the one that's manning the phones, doing the announcement, making the phone call to the fire department and so forth. Initial client education is done by the registered nurse. In most states, LPNs may reinforce initial client teaching given by the RN. Although nursing assistants can collect simple data, they have not been trained to make decisions about or interpret those data. And we think I gave you some examples of that. I think we answered correctly with all of those. For example, nursing assistants cannot evaluate results of a capillary blood glucose monitoring, a finger stick. It was 77. What does that mean? Is it high, low, is it within range? So that unlicensed personnel, so I'll let your nurse know and they'll come in and talk to you more about those results. Or determine when vital signs need to be rechecked. Is there a question? Oh, I thought I heard a question. When delegating to an unlicensed personnel, the delegated responsibility must be within the delegatee's authorized scope of practice under the Nurse State Practice Act. So make sure that we're not asking people to do anything that is not on their lawful to-do list. Making sure that we're not doing anything asking them to do anything that they're not supposed to be doing. Like I said, unfortunately, people will ask you to do things that you're not supposed to, but it's on you to know, hey, I can't not do that. And voice that. Licensed practice nurse as a first line leader. Charge nurse, expanded is an expanded role. So we're supervising nursing assistants. We're developing those leader and management skills. So the mission statement or vision statement defines the purpose and goals of why that organization exists. Even as a long-term care facility, why does that organization exist? More than likely, they're there to provide ADLs, skilled care, and those things. So when people come to that facility, that's what they're expecting to receive, those services and things that they have laid out in their mission and vision statement. And the task that we complete, it actually helps us to fulfill that facility's mission and vision statement. Okay. So the LPN job description, charge nurse experience usually requires a minimum of 1 year. Now, some facilities, it varies. Licensure, current license is targeted in that state. Standards, collaboration with the interdisciplinary team. Remember, you're going to be talking to everybody, the dietitian, looking at this one person, but thinking about all the parts that make up this person. all the tasks and things that need to be done, skills that need to be completed in order for this person to provide, to manage, to return to their optimal level of care. So, and also the LPNs, we are asked to assist the DOE, the Director of Nursing, in new employee orientation. You may be that mentor or that preceptor. Depends on what facility you're in, they call them different things. And then you will be the one that will evaluate the nursing assistant's performance. Some facilities do it every 3 months, every 6 months, every year. I think the longest I've seen is every year. So, but you're the ones that's going to sit down and rate them and give them input on how they're doing, things that they can improve upon. So the LPN's job description as that charge nurse, we're considering the entire person, all of their conditions. We're assigning tasks to the nursing assistant team members. We need to know what their abilities are and their skills. There's several moving parts to this thing. Then provide care within the scope of practice. We assist the doctor with therapeutic and other procedures. Recognize symptoms of pending adverse developments and report. We want to administer medications and treatments. Proper documentation. Take that time to document, whether it's electronic, on paper, whatever it is. If they're running a code, someone should be the note taker, making sure that someone's documenting and come back and do that proper documentation. When you want to make sure, even if it's you are reordering a refill on a medication, we want to take the time to do whatever that documentation is, so this medication can this person, there's no interruption in care for this person. Well, I can't give this person this medication because it's not here, because it hasn't been properly documented and communicated to the pharmacy of what we need in the dose. Because sometimes dosages will change. Medications will be DC'd. Some new medications will be started. Ensure appropriate and organized care in the department. Delegation. You want to ensure that there's is a safe environment for the residents and the team. You want to make sure that we're maintaining dignity and privacy. So this is not anything to be afraid of. It's just letting you know, hey, that, these are all the moving parts of being that charge nurse. And yes, you can take on that responsibility. What do I need to be in charge? Okay, facility organization, we need to know about that. We need to know about the skills checklist for staff. Their job descriptions, we have to essentially know what they can and can't do. We need to know about inspections, HIPAA, Center for Medicaid and Medicare. We need to know about the documentation requirements for these different Medicaid and Medicare, and also these different insurance companies. There's so many out there, and some of them require, well, all of them require like the basic stuff, like vital signs and the orientation, level of consciousness, but some of them require specific things. So it's on us to know what the national patient safety standards are. What is that? Is it long-term care facility? Is it fall prevention? Acute care facility is more focused. They have several, but one that comes to mind is identifying the person, lessens the chance of someone receiving the incorrect care. So we need to know about all the policies, including breaks. What is the smoking policy? What is the uniform policy? Our name tags important? How are people clocking in and out? How is their time being calculated? What happens if we're using the time clock to use our finger or our face to scan? And what happens if that thing doesn't work? How are we communicating and reporting? Are we using cardexes? Is it written? Is it recorded? I remember the day when we used to have to sit down and record or press the recorder, and we had to, and then we exchange report that way. They've done it so many different ways. Records and department routines. What is the routines? Like, what is expected to happen on day shift? At a minimum, we know we can't control things, but at a minimum, what is the expectation of evenings? What is the expectation of weekends? What are those reporting methods? How do we get it? So we will have 80 people in a facility. They may have 50 different healthcare providers or however many healthcare providers. But what is our method of contacting that healthcare provider for this patient, which it might be different for the next patient. Depends on that healthcare provider. So it's on us to know all of these things. Care planning. How do I let the care plan team know? How do I be a part of the care plan team when something changes with this client? When we're going and implementing our interventions, we're assessing and gathering information. We're going to do the evaluation. Is this intervention working for this patient? So there are several moving parts. So what are the processes within this facility? What happens when someone dies? What happens when a code is called? What happens when someone's admitted or discharged? Do this facility have specific admission processes? Do they only admit Monday through Friday between the hours of, or is 7 days a week documentation needed? Okay. What about their safety? Does that facility have side rails? I've been in a facility where there aren't any side rails. So I'll stop sharing for just a moment. Something out of my throat. I don't know what it is. All right, so let's go back to our So, like I was saying, one facility I was in, they don't even have side reels, and some facilities do. So, what is their safety plan? How do they, how are they proactive? Do they have alarms? Some facilities don't have alarms anymore. Some do. When do we lock the door? If you're working on evening shift, when is the door locked? When is it unlocked? While these things seem minimum, they are necessary. So, what about the equipment? What if we need suctioning equipment? Where is it located? How is it cleaned? How do we communicate with dietary? This person needs, specific a specific diet. If the dentist just left and the dentist says, "Hey, they need soft food," but then their diet is regular. How do we communicate these things? What if the family wants a tray? What is that procedure? What if that patient has a guest? What is that procedure that family member or visitor can also eat? Is it cash? Do they have to turn in a ticket by a certain time? What is that procedure? So essentially knowing everything, even though we might not deal with some of the things that we need to know that often, but still we need to seek out guidance if we're unsure, because if we're in charge, they're coming to us for the answers for everything. Okay. Medications. How do we reorder? How do we get new medications? How are we documenting? How do we communicate? How are we collecting information when we have an incident report? So, collecting data as a charge nurse, signs and symptoms. Think about, sleep and rest, mobility, hygiene, just essentially everything, collecting data from everything from A to Z, and then going and asking those more focused questions depending on the client's responses. Okay. This one is just another way of looking at the charge nurse, encouraging responsibility. We talked about those things, reinforcing, offering praise and opportunities to encourage that growth. Okay. So charge nurse's role, employee home problem support, demonstrate empathy, don't fall into the monkey trap, do not counsel or on the problem. So we can identify resources for that person. Um, you know, and definitely don't escalate it. Provide the support that you think you need, that you can provide. The support sometimes is identifying resources because sometimes we, even though we empathize, we physically don't have the means or the necessary tools to help that person outright. But identifying resources that is providing assistance. Okay. So the family through their eyes, this is their loved one. And they're sometimes struggling with, I should have never even put them here. You know, if I only went to dad's home to check on him, his blood sugars would have been fine. We wouldn't have to bring him to the hospital, things like that. So they're dealing with a lot as well. Uh-oh, go back. So the family, how to respond. Of course, we want to be sincere. We want to be assertive, not aggressive. We do want to allow them to express their feelings. We want to be clear with expectations and be open and honest. Make sure that the information that we are conveying is understood, and we can ask them. Remember those techniques that we talked about last week. We can summarize the main points and ask them, hey, just to make sure, I want to make sure you understand and make sure I understand it, whichever way it goes. And so that things are clarified. But we do want to establish those therapeutic relationships with our patients. And that does not mean that we're breaking rules and doing things that are not on our state nurse practice act. Okay. So we talked about that care coordination. Now let me talk about continuity of care. Just think about someone that has multiple chronic conditions, that continuity of care with when the care is being coordinated and the people on the healthcare team are discussing, whatever it is, all those interventions, the goals and everything, will that increase the likelihood of a person being readmitted to the hospital, or will it decrease that person's chance of being readmitted to the hospital? Let me check the chat. So what you want to put decrease exactly, because we think about that continuity of care. We're having those conversations about this client's care. We're talking about all those resources. We even talking about the good, the bad, and the ugly. This client, they do good at breakfast and lunch. They're diabetic, but then at supper, they eat minimal. So in order for this glucose to not drop during the night, we offer a snack. It's important to make sure we give that, everything about that client. So once this person gets home and, their loved one, whoever's there with them, a caretaker, they need to know that this person might not eat that supper meal. We need to offer them a snack, something to hold them over, to tide them over. The client needs assistance with, their lower extremities, so they can bathe the upper part, but the client is going to need someone to come in and assist with bathing their lower extremities. Whatever those instructions are, that lessens the chance of that client having readmissions, setbacks, exacerbation. It lessens or either decreases that chance. When we're doing that change of shift report, what do we say that main object? We kept talking, I kept saying it last week, kept going back. So what is that main objective? Even with the change of shift, and even when we're communicating with others on the healthcare team, what's that one word that we just said that everything goes back to? Making sure that this client is what? Is with an S.
Is it safety?
Safety. I kept saying safety last week. Everything just goes back to that client being safe. Safety, safety, safety. Even with medication, we want to make sure this client's receiving the appropriate medication. Delegating tasks. We want to make sure that we're delegating a task to someone that's on their skill list that's able to actually perform that task. Keeping that client safe. That's all those things fall back to safety. So that enhanced communication, talking to those that's on the healthcare team. In addition to that, having that continuity of care and collaborating, do you think the client is going to be satisfied or unsatisfied with their care? If we are collaborating and we have that continuity of care, you think they'll be satisfied or not?
Satisfied?
Satisfied. Those things matter. Even if this client, they realize now they're a new diagnosed person with hypertension, they're newly diagnosed diabetic, because we have had that talk with everybody on the healthcare team. The dietitian has come in, the physical therapist has come in, whomever, all these people have come in, and it seems like everything is just seamless. Even if there are questions, the dietitian came in, we got the dietitian to come back because the client had more questions. So that client is should be more satisfied. In addition to that, less likely to return for readmissions because they understood. When they didn't understand, we got the person to come back in to go back over things. And so, with all of that being said, in essence, as a team member, we would even have that increased satisfaction as, oh, we're doing the best that we can for these clients. They're having good outcomes. We're thinking it through, we're communicating, and as a team, we'll feel better. So let's talk about this chain of command. So the chain of command is expected to be followed. Do we agree with that? Are there times when the chain of command may have to be overlooked or not used? And if so, when are those situations?
If your problem is with the direct above, then you would go higher than, like, if you had a problem with your manager, then you would go to like their manager.
Okay. What about when we're doing patient care? Is there certain times that the norm is we report to the charge nurse? But if this is an emergency situation and we need an immediate action, would we still go to the charge nurse, or would we bypass the chain of command and go to whomever that can directly address them promptly, the question or whatever it is, the situation promptly?
Yes.
Okay, we would. The difference is I said emergency situations where an immediate action is necessary. So the norm is, that we follow the chain of command. But that's the norm. That's routine. This is not an emergency situation. But so following the chain of command, if the situation was urgent and an immediate action is needed, it can delay the care. Hence, it can also compromise that patient's safety. So only in emergency situations is when we do that. But effective healthcare delivery requires flexibility in judgment. So you'll have to make that call. Is this emergency? Does this require an immediate action? So, and then facilities, they do have policies and procedures that guides your thought process on that if there's an urgent situation. But what it's going to do is it's going to guide you to bypassing that next person and contacting someone that can directly address what immediately needs to be addressed. Just like when we were talking about the delegating, we would not delegate tasks that an unlicensed personnel would normally complete if that patient was unstable. That changes it. So the same thing with the chain of command, when it's emergent, then that changes. We need to talk to someone that can immediately address what the issue is. Okay. So we, as a nurse, we're responsible for supervising patient care, making sure that it is being competently delivered. And so we talked about the 5 rights of delegation. So we want to consider the skills and competency of the team member. We talked about that. We do want to go back and supervise the care that's being given, even though we delegated, it does not relieve us of our responsibility. And then we want to, before then, we've assessed the needs of the patient involved in anyways. We've decided what it is that they actually need. And then once we look at the skill mix or the skill tasks that people can complete, then we will decide on which team member we can assign those tasks to. So think about all those pieces, those things I just named, that's involved in that delegation. Okay. So I think I asked you, I think we had this situation too last week where I said that the nurse um, um, was notified, they received results from, I think I said the radiology department call or the lab call, and they received some critical results. The nurse followed the procedure to notify the healthcare provider, and there was no response. So the nurse notified who could provide that immediate action, but there was no response. What do that nurse do in that instance? Let me check my chat. What should that nurse do? I'm not seeing anything in the chat. What should that nurse do, y'all? We're having trouble answering those questions. Let me know. I can restate the situation. So the scenario was the nurse received a call from the lab department. They said that the white count was extremely low. It was extremely high. They received a call from radiology department. The person had broken femur. The nurse, what we do with those information, we will not be listed as failed to report. We must report that. So we are calling or communicating or trying to communicate to the healthcare provider that's assigned to that patient. But we're not getting a response. We looked at our policies and procedure. It says to page them. It says to call the answering service. We've done all of those things that are required of us. There is no response. What should we do? Well, what should we do? Someone come off mute and tell me. So we just document, oh, didn't notify them and move on to the next thing for the next patient?
Document, and then I know in a hospital setting they have like an on-call provider, or page the doctor again. If they don't answer again, you can go to their higher ups and report them for not answering.
Okay. So we would notify our nurse manager. And so they can make sure that we, of course, like she said, followed all the methods of trying to contact them, because sometimes they may have someone else on call for them. The answering service, the pager service, all of those things. If there's no response, we can't just leave it at that. We have to move further. And that means notifying our charge nurse or whoever, they have different names for, but the next person that's on that in that chain of command to see what's going on. What are the instructions? Because we can't just receive those results and just hold on to them and not report them to someone that can immediately address them. In the event that we do, and they call 1-800-lawyer or something, this client has a bad outcome, they're gonna make them look and see what we documented. Well, nurse, you received this information. We see you tried to call the doctor. We see you paged them. We see you did all those things. There was no response. What should have been done? That information just stay with us and we document? No, we should have reached out to our chain of command, the nurse manager, the DON, the ADON, and they would also reach out to whomever their next person is to see what's going on, because we can't just leave that client hanging out there. What if the nurse thinks that the coworker is taking some of the clients lisinopril or narcotics or insulin? If there's suspicion, what should that nurse do?
Alert their supervisor, and I think they should also approach their coworker as well.
We want to alert whoever the chain of command, the supervisor. They call them different things in different settings. Because right now we think it's a suspicion. So we don't want to, approach, our coworker. Right. And I said it was a suspicion. So we must report that suspicion to the nurse manager and then follow that chain of command. There may be others. We might have to do statements. Of course, they're going to bring that person in at some point and talk to them. They may even roll the camera back. They may do a pill count, all of those things. But the chain of command, we do want to report it. We don't want to keep that information to ourselves. We do not want to do that. Okay, are there any questions about any concepts that we went over so far? Okay, so far we've covered everything, and I'm just throwing you some scenarios out there. I'm looking in chat if there's a question about any one concept. Okay, yes, you all were putting in the chat. Tell the charge nurse, yeah, and you essentially, yeah, you're telling on. You're reporting. What has happened. According to the policies and procedure, I am supposed to, do these steps. I've taken these steps. I am not getting a response. Okay. So in the chat, if there's any one question about a concept that I need to go back over, let me know. Otherwise, we'll just keep moving. We'll go back to I'll just keep giving you some what ifs. So those readmissions, that's a thing that they look at, an indicator that they look at to determine if there's a lack of coordination or continuity of care for a patient. So they look at all that. This client just left the hospital, or they were readmitted the same day or the next day, or this client was discharged home, and they were readmitted or to a long-term care facility or what have you. But that hospital and readmission rate, they look at that, and especially if they're readmitted for the same problem. The same problem. Can an unlicensed personnel assist with denture care for a client that is stable?
You said, can they assist with venture care,
Denture.
denture? I'd say yes.
Okay. So that's a part of activities of daily living, bathing, mouth care. Mouth care can include if the person has dentures, partials, and things like that. Yes, so they can. That client is stable. Okay. Okay, let me pull up this other PowerPoint here. Give me just a moment. We'll go into our second break here in just a few minutes too. We're gonna save our other 15 toward the end, and then we'll give you some time to get in your week 10 groups too. Back over these. Okay, so let's go. Let's look at these here. I don't see any questions in the chat about any one concept, so we'll just keep on rolling. So let's stay on task here. So let's take our other 5-minute break here. So, and then when we come back, we'll look one more time at all our concepts, and then we'll give you some time to talk in your week 10 groups. And then because we have that break at the end that we always push to the end. Okay, so we'll see you back at 7:36, if you're on Eastern time. Okay. Okay, anyone come up with any questions? Any concepts that we went over that you're still not clear on? So even though it is care coordination, communication, leadership, and collaboration, there's still all those moving parts. And so we've covered all of our material, but I just want to go back over a few things just to make sure. So is giving advice negative or positive?
It can be both, but I'd say positive.
The patient said, nurse, what would you do? Is that negative or positive?
That's negative.
Okay, so giving advice, remember, we want to support that client in whatever decision that they make. We want to make sure they make an informed decision. So if that means bringing someone back in, then to re-educate, then that's what we do. But we don't want them to not make whatever decision they think is best for themselves, an informed decision. So giving advice is really a negative. It's a negative, but we do want to bring them back, to make sure they can make an informed decision. Is how I just narrow it down to. So is aggressive or assertive? Which one is behavior that is favored or conducive for collaboration and care coordination? Being aggressive or assertive?
Assertive.
Okay, so that's being honest, telling the truth, being specific with the information that you're actually giving to the client. Okay, so the rest of our time we'll use here. Of course, we have our 15-minute break at the end. So we have about 12 minutes to get in your small group. Any questions you all have about the group project as a whole right here? So we only have 12 minutes. So any questions that you have for me about your group project? Any questions from me? So if you're running into an issue with completing your task within the group, please do not wait until the last minute to communicate whatever that is so that plan B, C, D, E, F, G, all those things can be worked through. Try to find your groups here now. So communication is a huge piece for completing that care coordination. We just talked about that, completing this task. So don't be afraid because things happen. Things happen. Okay, so let me open up the breakout room and we have about 10 minutes to be in that breakout room. Let's see more and breakout room. Okay, sign. Okay. Okay, breakout rooms, you should be receiving an invitation. So we'll be there for about 10 minutes and then we got our other break on the other end. All right, accept the invitation and go to the breakout rooms. And I'm just gonna stop the recording in the breakout room section. Okay, the rooms are closing. Everyone should be back here shortly. So while the breakout rooms are closing, if you don't have any questions or concerns for me, you can go ahead and log out because we say this in to take our last 15-minute break. So take care. We'll see you on next week. Exam
right.
2.
Thank you.
You're welcome.
Bye.
Bye-bye.
Bye.
Bye-bye.